Hi, Stefan here. Welcome to the Iron DPC podcast. I'm here with special guest today, Dr. Pierre Cloutier. He is the author of a book, A Personal Guide to Health, which I've read from front to back. I recommend anyone read this. It's a summary of his research towards finding optimal health for his patients. And it's a very easy to read and very comprehensive functional medicine, I'd say, textbook, essentially. So he's here in Florida right now, but you still practice in Canada, right, at the hospital?
Mm-hmm.
And I think you should tell everyone your story of how you never wore a mask the whole time, because this is a very funny story. And you still don't wear a mask. No. Tell them how this happened. How did you manage this?
But there was the rule in the hospital to wear a mask, okay? And I did my research, and the masks are useless. So, and then the head of the personnel came to me, he said, wear a mask. I did show him some reading. He said, okay, do what you want. And then after that, because that was like a big thing, because everybody was talking about it, the director of the hospital came around 3 o'clock at the emergency room where I was working in front of the nurses to tell me to wear a mask. So it was like I did. My little character, little boy, woke up, and I told him in front of everyone, because he couldn't have come in my office and talk it, but he wanted to show his dominance. So I told him, why did you hire me if you can run the emergency room? So you hire me to call the shot? So if you ask me to wear a mask, I'm leaving right now, you take care of the emergency room yourself, and I'll take my retirement now. Oh, he said, do it. And that was like just funny.
That is badass. That's cool. So, I mean, you're a functional medicine doctor, but you work in emergency medicine, yeah?
Yeah.
How do you incorporate any functional medicine into the emergency room, or is it really just, cookie cutter?
It's the emergency room that brought me to that, because in the emergency room we see a lot of sick patients. They're always not always the same, but the same history. People, they drink too much, they smoke, they drive too fast, or they eat bad, and that's my clients in the emergency room. So in 1995, around those years, somebody told me, your patients are not deficient in a medication. A medical student told me that. Wow. Oh, never seen it this way. So then it started a new thing. So when I give a medication, in the emergency room, to give a medication, antibiotics is the good thing, because for a short time, we don't treat chronic diseases. So I started to look at the cause of diseases that I didn't know, and was not taught in medical school. So it's just a long journey from that. I called a doctor who knew more than me. He said, man, go with the American Academy of Anti-Aging Medicine. They give good training and read the books of the teacher. And then it started like that.
Wow.
And over those years, I made some research, some collection of data, and there's a lot of things you read, you cannot all remember, so I took notes. And at some point I said, maybe I should write a book.
Yeah.
So that's it. So it's a collection of all
your knowledge.
Yeah. But I don't know everything that's in the book. The book has more than my knowledge, because sometimes, the other day there's a patient who sent me a picture of a page of my book, and I read that, I said, my God, it's good.
I write that. Yeah, you have optimal reference ranges as well, and so I guess even in Canada they don't use optimal reference ranges, they use disease population reference ranges, and that's what everyone bases their practice off of, right? Yeah, it's unfortunate. Like some of the key things, you think vitamin D levels should be above 60, right, as minimum?
No, I would not go above.
No?
Because I don't know. It should be sufficient. Right. It's like any hormone. Vitamin D is a hormone, is a steroid hormone.
Yeah. So
we should not have a deficiency, and we should not have too much. That's where the range is. Most of the people are deficient in vitamin D. So, but I think since it's a steroid hormone, if we take too much, it's not harmless, because it will bind any receptor of steroid hormone, so it will bind receptor of testosterone, and it will not activate it, so it may have side effects. And also, if somebody is taking a lot of vitamin D in a magnesium deficiency, that's not a good thing to do. So when you take vitamin D, you should always take magnesium.
Yeah.
Because calcium will be more absorbed with vitamin D. And then the calcium, it's +2, magnesium +2, will take the place of the magnesium, and a lot of bad things happen in the body when the calcium takes the place of magnesium.
Oh, yeah.
Usually it happens in the magnesium deficiency, but most of the people are magnesium deficient.
I also recommend K2 with the vitamin D, right? Just to prevent the theoretical problem of the calcium deposits in the arteries.
Yeah. And that's the thing to do, because when you have enough K2, a healthy person should have enough, because the K1 is the food, K2 is made by the bacteria in your gut. So you're supposed to have good bacteria, but maybe people don't have that. So the K2 is the vitamin that will maintain the calcium in the bone, not other places. And it will calcify the artery when you're deficient in magnesium. So I think the best thing to do, what you do, is to give K2 and magnesium, and then the calcium will be in the bone and nowhere else.
Right, exactly. The other nutrients you talk about in this book are selenium and iodine. And interesting, you describe how selenium is anti-cancer. It's antioxidant. It's it seems like this miracle little mineral, the selenium. But it's deficient to the population. Everyone's thyroid is low.
Selenium is important for the enzyme that will transform hormones. So if there's a lack of selenium, a lot of bad things will happen in the body. So instead of measuring all this, that will be very complicated. To take a selenium like 100 microgram, I will not recommend over 200 microgram, because too much selenium can be a bad thing too. So 100 microgram a day, everybody should take it to be sure, they're not deficient.
Right.
Because there's so many enzymes that needs selenium.
Yeah, and iodine gets sometimes some bad press. Some endocrinologists say you shouldn't take iodine if you have Graves' disease, or you have, what's it called? I don't understand why they say you shouldn't take iodine. I think it's deficient for the most part. I can't reason.
Yeah, because if you take a high dose of iodine, it can block the thyroid release of hormone for sure.
Sure.
And it's a phenomenon. It's not dangerous. You can be hypothyroid for a few days. It's not a big disease. But the deficiency in iodine, it's terrible.
Yeah.
Because it's a halide, fluoride, chloride, can be toxic in iodine deficiency, because it will take the place of iodine.
Yeah.
Just an example, when we give iodine supplemented in dose high enough, if you measure the fluoride in the urine, it will increase. So it's a chelator of the fluoride, because it will take its own place where the fluoride should never have been.
Right.
So.
And people are getting plenty of fluoride in the toothpaste, in the water supply.
So,
you don't need so much fluoride. It's toxic.
The people, I think it's named Dr. Abraham, is a PhD. He did a study that, because in the 1920s, they made a study that decided to iodize the salt in the United States. At the time in Europe, they didn't do it. They did it here because there was a lot of people, because of the lack of iodine, they were so hypothyroidism that their brain will not develop enough.
Yes.
Okay, it was a place, because iodine, it flows in the water, it always goes to the sea. As soon as you live in a little altitude, there will be no iodine in the food. So you have to import it.
Yeah.
Okay, and it has serious consequences. So Dr. Abraham redid those studies, because when they iodized the salt, they said, okay, enough iodine for the brain development. Okay, that was good, but maybe not enough iodine for the other need. And Dr. Abraham, it's in maybe 2000 or something, around those years, he made a study and he realized that people are more deficient than in 1920.
Yes.
20. Yeah, more deficient now in iodine, because the needs are higher. First, there's a fluoride that may need more iodine. Half of the salt consumed is not iodized, because sea salt is not.
I see.
And when you put salt that is iodized, if you cook it just evaporates. So you should use the salt on the food you eat, not in the beginning. So it's like to take iodine supplement in the salt at the time that was something easy because it would be universal. But now iodine supplement should be taken separately.
I see.
I think
That makes sense. Wow. Very good. And then you talk very extensively about a bioidentical hormone replacement in this book and the importance of this. Not just in conventional medicine, they think of it, you just want to give somebody erections or improve sexual inquiries. They think of it as mostly for that purpose. But in the book, you describe the multifaceted benefits of hormone optimization, right? Bioidentical, particularly, we should make the distinction.
The body function with the hormones. Hormones are messenger that tells things. Thyroid does that, testicles and testosterone, ovaries. So there's receptors for those hormones in the whole body. And now we see, like, talk about testosterone, all the other hormones have the same principle. Usually men that were older would have low testosterone and younger men would have a lot of testosterone. That was like in the 60s, 50s, all the study that have been done. So just for an anecdote, one day I had a patient who was 84 years old, but the force of the nature, big shoulder, strong, a little chubby, but very strong.
Yeah.
I did, may I ask, may I test your testosterone?
Yeah.
It was completely normal for a 25-year-old.
Amazing.
So look, he had the phenotype, he had the physical body, straight back, he was like just a smile naturally and easy to have fun with.
Yeah.
And on the other side, I had like a 31-year-old guy that was like psychiatry, depression, and finally I checked testosterone was very low. Okay, so I'm not saying that testosterone is a treatment for depression, but if you have a very low testosterone, the cause is maybe the pollution, the estrogen mimicker, name it, difficult to find. But as soon as we gave him a normal level, it's not bodybuilding. We don't do 10 times the level.
Right.
We put it at the optimal level for 25 years old.
Right.
All his problem, I would say mind problem, lack of energy, lack of motivation, lack of everything. He had to go to the gym, but he didn't like it, and it's solved, completely solved, because that was the cause of his problem. So it's like I say to patient, sometimes the patient, they improve a lot on things, and one thing is not improved by acid because it was not caused by hormones.
Right. It's caused by something else.
Yeah, it does improve the problem of the hormone. Yeah.
I see this as well in my practice in this day and age. Young guys, low testosterone sometimes, old guys, great testosterone, and then oftentimes old guys, low testosterone, young guys, great testosterone. Just is variable.
Oh yeah. One thing, when I advise a patient to take testosterone, he will ask me, will it be for the rest of my life? Probably, yes. And then he says, I don't want to get addicted. So I had to convince myself that is a good thing to do. Because when I advise the patient, I cannot just say you have to destroy, you decide. He will not know. I have to guide him. So me, I was not convinced. But I saw a study that did convince me. They took people 45 years old with low testosterone. They decided to replace half of them with testosterone. The other one, no. Follow for 5 years. Okay? At the end of the 5 years, the one on placebo, no testosterone, were tested to see where the testosterone was. And the one on testosterone, they did stop the testosterone for 2 months because it's about the time it takes for the testicle to come back and make the level that it will do. What's interesting, the one without testosterone, at 45 they were low, because they were selected to be low, so they were low, but at 50 they were lower. Okay. But the one that had replacement, they were low when they started, but they were equal 5 years after. So it's a good because the explanation of that is that when you take a supplement, the hormone is made by the testicle try to make it. They get tired, they cannot succeed, you know? So they damage more. As soon as you replace it, you don't shut down, they will still work. Usually the site will be half of the site, so they still work. But they rest, understand? So they are not damaged by this. So if there's a nuclear war or something, you cannot get any testosterone, the one who were on it will not be worse than they were at the time they started.
Amazing. That's reassuring.
Yeah, sure. And when we do a medical intervention, we have to be sure, if we can, that the patient will benefit from it on every sense. Sure, if I give testosterone, somebody will benefit immediately, but I have to consider it in the future, and in that situation, it will benefit all the time.
Yes.
Even if I stop, it will not be damaged by the replacement. It will be even better.
I think you mentioned something about how it's even cardioprotective. This is what I found as well in the literature.
Yeah.
Yeah.
There was a study that says testosterone could be, but that was a wrong study.
Yeah.
It was a study
To suppress it.
propaganda.
Propaganda.
Some people do that sometimes.
Yeah.
This brings to a point that people sometimes ask themselves, should I take hormone? But when we give hormone, we don't do bodybuilding. That like bodybuilding would, to make a definition, will be somebody who have a normal testosterone, but he's not having a big body enough. He would like to increase his muscle mass to a desire. He sees himself bigger. He will take 10 times, 100 times the dose of testosterone and will trail a lot. That's bodybuilding.
Yes.
So when we give testosterone, we be sure it's low, and we give to an optimal level that is not too high.
Right.
So it's completely safe, and it benefits doing the job of testosterone. Same thing for thyroid, estrogen, progesterone,
Yes.
even growth hormone.
Yes. Yes, you talked about growth hormone as well here. Are you able to prescribe that in Canada?
Yeah.
Awesome. Excellent.
Growth hormone is like a taboo. Like, what is it, growth hormone? Why do we need it? The growth is growing, cancer grow, you know, but like, first growth hormone is called growth hormone because the kids who don't have it don't grow. So growth hormone. But they have 7 times the level of an adult.
Yes.
Okay. So in an adult, it should be called a different name. It should be called the repair hormone because it maintains the stem cells and all other things to repair the body. So when you have low growth hormone, you repair less. So most of the people over 35, when I say most of the people have a little deficiency of growth hormone.
Yeah.
That is not necessarily severe, but they would benefit to take some. And the enemy of growth hormone is sugar. So if somebody take growth hormone, should not take sugar.
Yeah.
There's Walter Longo that is long work on the IGF-1, and he says if you have a higher IGF-1, it's not that good. Growth hormone will increase the IGF-1 when you're young, but it will not when you're older. So if somebody is not deficient in vitamin D, doesn't eat sugar, keep insulin low, there's not interest to take growth hormone.
So if you give someone growth hormone, you won't see an increase in IGF-1 on the blood work?
It will at the beginning for the first 5-10 years, but this will fade over time. And it's not a reason to increase the growth hormone because IGF-1 is an indirect measurement of the growth hormone.
Correct.
So the growth hormone will still do its job of a growth hormone, but without the IGF-1.
Nice.
After, I would say, 60, 50, it will.
Yeah, I would say you can measure it, sure, to get the diagnosis, because sometimes in the US and certain countries you need like a diagnosis of adult growth hormone deficiency to prescribe it. But then after that, dosing it based off the IGF-1, I don't agree with that so much. It's kind of useless. Now, you like also estrogen replacement for women, estradiol. You like the bi-S, the E2 and estriol, I believe. You like the bi-S version or just?
That's the way I've learned because estriol is the one that makes the tears more in the eyes, in not the tears, but the mucus.
Oh, the mucus.
That the eyes are less. It's also good for the vagina. So because it's estrogen that is 5 times less powerful than estradiol. So we will bind the receptor also, and estradiol will not have a stronger effect. So it's like more like the nature does it. That's the reason why I like it. But a lot of patients, because they need the compound prescriptions, a little more expensive, more complicated. So I don't do it for everyone.
Yeah.
It's just the one who want at the best, and they've tried other thing and they're not satisfied. Some women, when we give just estradiol, the one who are very sensitive, they will bloat easily with that. So the dosage is very difficult to adjust. So when you go with bias, it will be simpler for those women. But I would say 20% of the women will be better with both.
Yeah.
But 80% will be fine with the
Yeah.
estradiol.
I found it's the same thing.
Yeah.
It works both equally well. Women also like progesterone in their later years for sleep, I found. It's critical for sleep.
Yeah.
Game changer. They tell me they haven't slept so well in 20 years, you give them a little progesterone at night.
And there's even people who cheat. They take 2, they take 3, and they sleep better.
Yes, 300
And then after
milligrams.
that, I want that though.
But yeah, the estrogen dominance is a problem as well in younger women. They have no progesterone during their luteal phase. It doesn't come up, and they cannot become fertile. They have all these issues. It's probably a component of the estrogen mimickers. So, and they don't have the natural cycle so much anymore. Very sad to see this. Very common.
There's the women that don't get pregnant easily. First thing is to take progesterone in the second part of the cycle, and I would say a good number will get pregnant. Don't stop the progesterone until the period comes.
Yeah.
It will maintain it.
Yeah.
Progesterone, progestation, that's the name of the hormone.
Yes. I also use Vitex, or the chasteberry. It's a little herb that helps them increase the progesterone. Works well for menstruating women as well. Good. Let's see. We covered pretty much the highlights here, the important parts. Maybe you should mention a little bit about fats and saturated fats. There's a lot of our colleagues, they want to lower LDL and lower cholesterol so much. What do you think of that?
I think 50% of the people who come in the emergency room with a heart attack have a normal cholesterol. And there's many studies that said the people who have a higher cholesterol live longer. So the cholesterol is connected to the vascular disease in a sense, but it is not the cause. Right? So I think to run after the cholesterol is to not to look for the cause. The cause of the cholesterol is not the cause of vascular disease. Right? So to lower it, there was a study at the beginning of those medication, cholesterol lowering, because now the cholesterol lowering medication, they lower the cholesterol made by the liver. They don't lower the one made by the brain. So, but the first, I don't know the name, it never been approved, but I think it was approved, but I don't know, approved or studied, but people were dying of suicide because it would lower so much their cholesterol in the brain that it would depress and die. And so it's the reason why he was treating all the heart disease. People were not dying of that, they were dying of suicide, but the longevity was shorter, so it was stopped. So that shows how cholesterol is very important. And all the studies on cholesterol lowering, people don't live longer. They have a little less because I believe it's a good antioxidant for the blood vessels that are already damaged. So they have a little less dying from the heart in the death certificate. But since they don't live longer, so they will die of 4 other things more to compensate. So that's a zero effect on the longevity. So the cardiologist is happy because you don't die in his field, but you will die more of accident, more of infection. So there's other things, you die more when you take a cholesterol medication. So I think those cholesterol medications are completely useless. And when a doctor gives a prescription for cholesterol lowering medication, he doesn't look for the cause, and he does what he was told in medical school, but that's not the real doctor.
Right. Yeah. There's a lot of other things that we do to prevent cardiovascular disease, and it's everything that we do in functional medicine. Is treat the root cause, the inflammation, the diet, the nutrient deficiency, the hormone dysregulation, all of this.
And I think an organ that a lot of people don't know it exists, called glycocalyx. It's the little hair we have inside the blood vessel, you know about it. And those, when they are damaged, the endothelium become damaged too. And that's the first thing that damages those little hair inside the blood vessels is sugar and trans fat. So that's the thing. If you don't want to have heart problem, stroke, any blood vessel disease, you have to have a healthy glycocalyx.
People know not to do the trans fat, but what they don't know is to avoid the seed oils, these oxidized oils, these canola, soybean, cottonseed oil. They drink this stuff, they think it's healthier to drink the corn oil.
Yeah, because it was a publicity, like margarine was better, but margarine is no good, should never be eaten. No. And one of the people say, oh, my glycocalyx, is he healthy? The first thing is your blood pressure. If you have high blood pressure, that's the dysfunction of the glycocalyx.
Wow.
Stop sugar, stop those vegetable oil, and the blood pressure in a lot. I would say if they do it right, the blood pressure will become normal.
That's what I found as well.
You found that?
Yeah, if they can fix the diet, they can do more ancestral or Paleolithic type of diet, that stuff will go away. The high blood pressure, metabolic syndrome. Difficult for some people to achieve.
Yeah, it's difficult, but at least when they'll be ready, there will be an answer. Yeah. Because people ask what I should do. You tell them. When they're ready, they'll do it.
Yeah.
It's not mandatory. I was smoking until I was 42 years old, so I'm not better than.
Well, the smoking. You see some Italians and some French and French Canadians, they live long and they smoke. It's luck of the draw, I guess, with that.
I think the next book I was going to write, the title will be They Cheat a Little. Because I've seen a lot of healthy patients, but they don't perfect. They're not perfect, They cheat a little, but a little.
Yeah.
A little. It's like, I think it's a...
Cheat a little. I like that, yeah. Great.
It is a little sugar, a little.
We'll end it there. That was fun. A lot of good info for everyone.